Welcome to the Deep Dive. We're here to cut through the noise and get straight to the core insights from your sources.
Glad to be here.
Today we're tackling something that can feel, well, pretty complex, navigating different levels of healthcare, especially that highly specialized care.
Right. What it is, when you might actually need it, and how quality standards fit into all this.
We've got some really interesting source material for this one.
Yeah, we do. We're looking at info about major healthcare accreditation bodies, international ones like JCI, Joint Commission International, and national ones like NABH in India.
Plus expert explanations on the different sort of tiers of medical care.
And even insights from healthcare consulting groups like Supreme Medic Consultancy who work in this space.
So our mission today is to really unpack what this specialized, they often call it tertiary healthcare, actually means for you.
When should it even be on your radar?
Exactly. And how things like accreditation can give you some confidence that you're in the right place when things get serious.
Makes sense.
Okay, let's start with the basics. These levels of care. Our sources lay it out pretty clearly. You've got primary care first.
Right. That's your first stop. Your family doctor, maybe a local clinic, a general practitioner.
The person you see for checkups, common colds, basic preventative stuff.
Pretty much. They handle, maybe 80–90% of everyday health needs. It's that initial point of contact.
Okay. And if they spot something that needs a bit more specific attention,
then they'll likely refer you up a level to secondary care.
And secondary care is?
That's where specialists for particular issues come in, often found in larger clinics or maybe district hospitals.
Like seeing a dermatologist for a skin issue, or maybe a general surgeon.
Exactly. Or an obstetrician. They handle things that need specific know-how, but aren't necessarily, super complex or rare.
Gotcha. Which brings us to the main focus of this deep dive, tertiary care.
Right. This is the really specialized stuff, found in the big hospitals, advanced medical centers, sometimes called super specialty centers.
This is where the heavy-duty treatments and complex procedures happen.
And what makes these centers tertiary really shows the jump in complexity. Our sources point to a few key things. First off, the technology.
Yeah, not just standard x-rays, right?
No, definitely not. We're talking advanced diagnostics, MRI, PT scans, sophisticated CT scans, cardiac catheterization labs.
Nuclear medicine, genetic testing, advanced endoscopy. Stuff that costs a lot and needs specially trained people.
Spot on. And that brings us to the second thing, the people, the specialists, or rather super specialists.
What's the distinction there?
These are doctors who've done significant extra training after becoming a general specialist. They often have advanced degrees like a DM or MCA.
Oh, okay.
In really focused areas like, say, complex cancer treatment, neurosurgery, heart surgery, organ transplants, or caring for extremely premature babies. Very narrow, very deep expertise.
And the infrastructure has to match, right? Like intensive care units.
Absolutely. ICUs and ICUs places designed to manage really severe conditions 24/7. That's crucial.
And then there are the procedures themselves, major surgeries.
Yeah, the really complex ones. Organ transplants are a big one. Complicated heart or brain surgeries. Intricate bone operations, bone marrow transplants.
Treatment for severe burns, advanced plastic surgery. Things that need the absolute highest level of skill and equipment and follow-up care, too.
Right. And what's really interesting and often necessary is how these centers go together whole teams.
Multidisciplinary teams, they call them.
Exactly. Surgeons, cardiologists, neurologists, kidney specialists, whoever is needed, all working together on a single patient. Especially important when someone has multiple overlapping health problems.
Okay, so that paints a clearer picture of what tertiary care is. But the really practical question for people listening is, when?
Yeah, when should you actually consider seeking this level of care? When does it become necessary?
Our sources list some specific triggers, and these seem really important to recognize.
Definitely. Probably the clearest, and the one you should always take seriously, is when your primary or secondary care doctor refers you.
They know their limits, basically.
They do. They're trained to recognize when a case needs more specialized expertise or facilities than they have. Ignoring that referral, that can be a big mistake.
Makes sense.
What else?
Well, the nature of the condition itself, if it's really complex or rare, think severe chronic diseases, maybe advanced cancer, really complicated heart disease, rare genetic disorders, or chronic conditions that are really disabling and not getting better with standard treatment.
Okay. Or if it's a rare diagnosis.
Yes, exactly. Congenital disorders, maybe organ failure needing transplant evaluation, certain autoimmune diseases, complex infections that aren't common. Stuff that a general hospital just doesn't encounter often enough to build deep expertise.
The need for specific high-end technology is another big flag, isn't it?
For sure. If your treatment plan involves things like highly targeted cancer therapies, maybe robot-assisted surgeries, specialized radiation, or those really advanced diagnostic scans we mentioned, you're probably looking at a tertiary center.
And, critically important, if the situation is life-threatening or needs immediate, high-level help.
Like major accidents.
Severe accidents, yeah.
Yeah.
Major trauma needing complex surgery right away. Or emergencies like a major stroke or heart attack requiring advanced neurological or cardiac intervention. Those cases often go straight to tertiary centers because they have everything ready.
And you mentioned multiple problems overlapping.
Yes. When multiple organ systems are involved, the sources give the example of someone with diabetes who then develops serious heart disease and kidney failure.
Ah, okay. That clearly needs a coordinated team.
Exactly. You need the endocrinologist, the cardiologist, the nephrologist all talking to each other. That's what tertiary centers are set up to do well.
One last trigger point.
Yeah, and this is one that, might get overlooked sometimes. If you've been getting treatment at a primary or secondary level for a condition and you're just not getting better.
Despite going back multiple times.
Right. Your symptoms aren't resolving. That could be a sign it's time to escalate, to get a fresh look from super specialists at a tertiary level. Maybe they'll see something different.
So if you find yourself in one of those situations, pursuing tertiary care offers some clear advantages.
Absolutely. The main ones highlighted are, first, that deep expertise for complex problems. This often leads to a more accurate diagnosis and a truly tailored treatment plan.
And access to better treatments.
Potentially, yes. Access to cutting-edge treatments or technologies that might not be available elsewhere. And that can definitely lead to better outcomes in some cases.
Plus the team approach.
Right. That multidisciplinary approach means you get comprehensive care. The whole picture is considered by a team of experts, not just one person looking at one part.
So how do you actually get into this level of care? We mentioned referrals.
Yeah, that's the usual route.
Yeah.
Your current doctor typically needs to initiate the process, send your information over.
Okay. And then practically, what do you need to think about?
Well, logistics. You'll definitely need to check your insurance coverage. Many insurance providers have arrangements or tie-ups with these larger hospitals.
That's important.
It is. And just be prepared. Sometimes there can be longer waits for appointments, or you might need quite a bit of diagnostic testing. That's often part of dealing with these complex situations.
But the goal is the highest standard of care for that specific complex problem.
Exactly. That's the aim.
Now, the sources also offer a word of caution.
Don't just try to bypass your local doctor and go straight to a super specialty hospital for everything.
Why not?
Well, first, it might not be necessary, and it can actually cause delays if your case doesn't really fit their specific focus. And second, it puts a strain on resources that are genuinely needed for the most critical and complex patients. Use the system as it's intended.
Right. And are there common mistakes people make when they do potentially need this level of care?
Yes, a few are mentioned. One is waiting too long, even when things are clearly getting worse.
Understandable. Maybe wanting to stay somewhere familiar?
It is. But insisting on staying at a smaller, familiar hospital when your condition really demands more advanced facilities can be detrimental. And definitely don't ignore that referral.
Good point.
Also, remember that excellent government tertiary hospitals exist places like AIMS, PGI Chandigarh, GIP Mayor, various state medical colleges. They're very capable options.
And don't just assume cost equals quality.
Right. More expensive doesn't automatically mean better for your specific need. Always check the hospital's credentials, accreditations, and the specific specialties they excel in.
And it sounds like empowering yourself with questions is key.
Absolutely. If you're worried things aren't improving or seem complex, ask your doctor directly. Is this something that needs a super specialist? Or could you help refer me to the right tertiary hospital for this condition?
Okay. Let's shift slightly. If you do need tertiary care, how can you get a sense if a particular hospital is really up to the task? If it provides high-quality, specialized care?
That's where understanding quality standards and accreditation becomes really helpful.
Like the ones mentioned in our sources.
Exactly. One major international player is Joint Commission International, or JCI. They're recognized globally as a leader in setting standards for healthcare quality and patient safety.
They operate worldwide.
Yeah, in over 70 countries. They have more than 1,000 accredited or certified programs. Their whole mission is about enabling and affirming the highest standards of care and safety.
And they set specific standards.
Very rigorous international standards, yes. and also specific international patient safety goals that hospitals work hard to meet.
What does achieving that JCI accreditation actually mean for the hospital and for the patient?
Well, for the hospital, the sources say it helps improve teamwork, gives them a competitive edge, builds community confidence. But for you, the patient, it signals things like better risk management, a structured approach to safety, and a culture where patient safety is really ingrained. It's a strong indicator of commitment to high quality.
Okay, that's the international picture. What about nationally, like in India?
In India, there's the National Accreditation Board for Hospitals and Healthcare Providers, NABH. It's part of the Quality Council of India.
And its focus is specifically Indian healthcare organizations.
Yes. It was set up to establish and run accreditation programs tailored for India, setting national benchmarks for the health industry.
And is NABH accreditation seen as significant?
Very much so. Our sources explicitly list NABH accreditation as a key indicator that a hospital is indeed equipped to provide those complex tertiary care services we've been talking about. It's a recognized mark of quality and capability within India.
Getting these accreditations sounds like a lot of work for a hospital.
Oh, it is. It requires implementing really robust quality management systems. That's why, as our sources note, hospitals often work with specialized consulting groups.
Like Scream Medic Consultancy.
Exactly. That's one example mentioned. They have teams with experts in hospital strategy, quality improvement, helping hospitals navigate the process to achieve and maintain standards like NABH. It shows there's a whole support system behind achieving this level of quality.
And just thinking about the range of specialties hospitals cover.
Yeah, even looking at some of the topics mentioned indirectly in our sources, things like managing complex chronic diseases, specialized care for seniors, advanced mental health treatments, cutting-edge imaging.
It really drives home the depth of expertise that's out there, especially at these higher levels of care.
Definitely.
Okay, so let's try to wrap up the key takeaways from this deep dive.
All right, so tertiary care is that essential, super specialized level for conditions that are complex, rare, or life-threatening. It's where you find the advanced tech, the super specialists, the coordinated teams.
And getting there usually and ideally starts with a referral from your primary or secondary doctor. That referral is really important.
Crucial. Listen to your doctor and make sure this high level of care is genuinely needed for your situation. Recognizing when to escalate can really impact your outcome.
And when you are looking at potential tertiary centers, understanding quality markers like JCI accreditation internationally or NABH nationally, that can be really valuable.
Yeah, they signal a commitment to high standards of care and safety. But always start the conversation with your current doctor to find the right path for your health journey.
Absolutely.
So here's a final thought for you to mull over today. We've talked about these different levels of care and how quality is measured. Think about this. How does understanding all this, knowing the difference between primary, secondary, tertiary, knowing what accreditation like JCI or NABH means, how does that empower you?
As a patient or maybe a caregiver.
Exactly. How does this knowledge help you ask better questions, engage more actively with your doctors, and maybe make more informed, proactive decisions about getting the right care at the right time, potentially even before a crisis hits? Something to consider.